for joining us in person as well as on the live stream this morning. Punchbowl News is a 4-year-old media startup focused on power, people, and politics in Washington, D.C. And I'm thrilled to be here in Charlotte this morning. It's a little colder than I expected, but we will survive to host a conversation with Senator Thom Tillis, the Republican from North Carolina, focused on investing in communities as part of our partnership with the American Investment Council. After my conversation with the senator, I'm going to be joined on stage for a fireside chat with Drew Maloney of AIC and Robert Mittl Jr., a neuroradiologist at Charlotte Radiology. As always, we encourage you to share about this conversation on social media. You can find Punchbowl News at Punchbowl News on all social media channels. And with that, I'm going to welcome Senator Tillis to the stage. Sir. Thank you, thank you. Welcome. We'll have you here in the middle. All right, Senator, thank you so much for joining us.
Thank you.
It's fun to be in your home state. We are going to kick this off with a few news of the day questions before we get into the conversation about private equity in North Carolina. First of all, talk to us about the recovery effort following the hurricane. How are things going so far here?
Not well. I think a lot of people, unless you've been out there, I've been out there for 7 of the last 2 days or 2 weeks. And the extent is just hard. The depth and breadth of the damage is just very difficult to understand unless you're out there. I mean, imagine having a dozen major river basins flooded with 20 to 30 inches of water all at the same time. And so where with Fred we had Clyde, that was one devastating event in Haywood County, we have a dozen of those across the state. I talked to the Postmaster General on Sunday. We have 15,000 addresses that can't be delivered to today. We have in Yancey County 2 communities, one community of 500 people that are just now getting a temporary road built to get ingress and egress, 500 homes. Another community, 150 homes that may not be without power until the spring unless we can convince the Forest Service to run a power line from Tennessee to this community. There are dozens of those examples. It's going to take tens of billions of dollars to recover, and I think that some of the communities on the brink of never coming back. So we've got to get out there and fight. In a word, it's really bad.
And you think the government's going to do an emergency package here at the end of the year?
Yeah, we have to. You know, we know that we've SBA. You know, this is not a very difficult job to do on 8 good hours of sleep. It's pretty easy to figure out and pass as prologue. We should not have even been having a discussion about going back and plussing up SBA. We knew that we were going to run out of money. Now we have. Right. And I was trying to explain to my colleagues who've said it's only 3 weeks, we can come back. You go tell that to people who may be without power for the next 3 or 4 months. 3 weeks seems like a lot longer time to kind of figure out where they're going to be if you're not in the warm confines of a place that wasn't affected by a storm. So I think we've just got to be unapologetic, charge in there, plus up the disaster relief funding, the recovery funding, and the Small Business Administration. Mm-hmm. What a lot of people don't realize is that when you go, Small Business Administration is just out of money. When you go into some of the FEMA accounts, you can say as a FEMA administrator that I have money to deal with the individual needs funding, but what they're not, and they will say, but we're going to have to delay payments. What people need to understand, delaying payments is not for individual assistance, but major projects for resiliency and rebuilding that you're just delaying payment on. So it's sort of robbing Peter to pay Paul that we have to let effort. We've got to walk, chew gum, run all at the same time.
All right, we normally are very focused on what's happening inside the Capitol, and one of those big things is the Senate GOP leadership race. You've been pretty outspoken. Yesterday you sent a Dear Colleague letter calling into question some of the demands from conservatives that would weaken the leader position. I think kind of a 2-part question here. Are you confident that enough Republicans will resist the urge to decentralize leadership power? And secondly, you ready to make some news about who you're going to support?
I'm going to support a guy named John, and I've told Rick Scott, who's a friend of mine, that it comes down to those two. And And at some point, I'll make a decision about which one it is and try to help them get elected. But I'm really watching them right now. And a part of it is anybody who takes the bait that says we should weaken the leadership role has just made a disqualifying statement for me. You don't weaken the leadership role that's already a weak leader as compared to the Democrat leader. It defies any knowledge. It'd be like you business people saying, you know what, that CEO, we don't want them to make the calls in the heat of the moment. We want a committee on committees to recommend that and then determine whether or not that should even be discussed. It defies any logic in the business world. And why on earth, when you know and you can measure the power of Chuck Schumer, who I consider to be a friend, a political adversary, but a friend, he's got more power than you can possibly imagine. And people wonder, Republicans wonder, why is it that the Democrats act so, put together and all one team? Is because if they don't, they will get their asses handed to them by the leadership for stepping out on things that don't matter. I mean, we need to realize we all have our individual priorities, things that I would like to get done. I would never sacrifice the productivity of my conference for any one of those things that are personally important to me. The only way you prevent that sort of risk coming in and reducing your organizational productivity is to have a strong leader. You should have a safety valve. Look, if somebody goes rogue, have a safety valve and figure out how to keep them in check. But we've got to match up better. I, as a Republican, want to match up better as Democrats, want to get more out of our organization, and you don't do that by weakening the top role.
All right, we're going to get to the topic of the day in 1 second, but it would be remiss if I did not talk about the election. We were talking backstage about just the number of ads that are kind of pelting all of these stations when you're watching television. It's been a while since North Carolina's been a swing state.
It's our own little stimulus package.
There you go. In the presidential election, there's been controversy with the Republican governor race. Talk to us where you see things standing, in November, a few weeks from now, in North Carolina.
I think that Trump will likely win North Carolina at or a slightly smaller margin that he did in 2020. I was up in 2020. I had a net margin of 96,000 votes. President Trump had a net margin of 75,000, larger gross. I think that he's probably tracking somewhere in that range right now, but 3 weeks is an eternity. He has to keep focused on the prize, and I also think that there are a couple of blue wall states that are ripe for the picking if we execute properly. So I think Trump wins North Carolina. I still think it's rightfully considered a toss-up nationally. Mm-hmm. But in the state, we've got a lot of down ballot races that I'm watching very quickly. I invested a lot of sweat equity into getting a majority back in 2010, so I watched the legislative races pretty quickly. We've got a few where Republicans are substantially challenged in suburban districts. We'll maintain majorities in the state house and Senate. The question will be the margins. Mm-hmm. And then we've got the whole council of state races.
Right. Okay. Well, we are here because this is part of our series on investing in our communities with the American Investment Council. Let's talk about that. North Carolina is a top state for private equity investment. How have you seen that play out in the state over the past 5 or 10 years?
Well, I think if you take a look at the sector, when we came into the majority in 2011, we really got people focused on strategic sectors. What I had observed from the outside is we were kind of all things to all people, take all comers, any businesses that came in, but we really didn't have a differentiated message on why North Carolina. So we started doubling down on biotech, obviously financial services, energy sector, and we've made great gains. And if you take a look, particularly in the biotech space and financial services space, private equity has been a very important part of the ecosystem to drive innovation and to really drive the historic growth that we've had in North Carolina over the last decade. And I think a lot more to come. Long as we keep our regulatory and our tax regimen focused, there's no reason why we won't blow past even more competitors than we have over the last decade.
I want to talk about taxes in a little bit, but the numbers are pretty significant. $28 billion in PE investment in 2022, nearly 600 private equity-backed companies in North Carolina, and there are more than 40,000 private equity-backed jobs for small businesses in particular. What kind of impact does that have on the state economy?
No, it has a huge impact. I mean, I was talking to Ryan. I think Ryan's here. Ryan's in the back of the room. My staff that covers financial services portfolio. They fill in a lot of the gaps. Now, quite honestly, some of the gaps that they're filling in is because we're doing such a horrible job of regulating some financial services options. So private equity is rightfully moving in that, but for reasonable policy, they may have competition. I don't care as long as you're filling the need. But I was just talking to Ryan this morning about how do we create a private equity play in rebuilding in storms. What could we do? Right now, if I'm looking at the damage in Western North Carolina, I see, but for substantial public sector investment, some of these communities are going to be at risk of recovering. I think we should get more creative about how we get leverage out of the private sector to go after at least the communities that need help, but there's a clear upside to their recovery. To the extent that we engage more private sector there, that frees up more public sector resources for for public investment. These communities are not going to bounce back. I think it's a better way to get leverage out of organizations that go into high-risk situations. They make the right bets, they execute properly, they manage properly, and they return value for themselves and for the communities. We need to do more of that, but we're already doing it. I think, if we focus now, electronic vehicle supply chains kind of move through North Carolina as well. We've got a lithium mining operation we hope to get up and running when global prices bounce back over about 45 minutes from here. So I think constantly looking at how we're driving, just doubling down on making this state attractive for private equity and other investment in financial services, biotech, power generation, electrification. We're well poised for it. Geographically, we're well poised for it from a policy standpoint coming out of Raleigh.
Yeah, it was interesting. I was thinking, you kind of took my next question here, which is there a role for that private capital to be playing when you think about some of the recovery of these efforts? Are there certain industries, or is it getting kind of local politicians, the governor on board with that kind of a play? Because it seems like that's really kind of the public-private sector maybe kind of working together there. Yeah,
I've got a call with my all hands call this morning with my staff to this being one of the subject matter. How can we get more people to realize we will move more quickly and be more efficient if we have an investment of the private sector in rebuilding? And I'm not talking about the mom and pop shop that just needs an SBA loan to get restarted. I'm thinking a lot more broadly. How do we incent the private sector to deal with a major resiliency problem that we have in communications, for example? We should not just be digging trenches and trying to lay more fiber optic. We need to do that. But we clearly need a space-based option or non-terrestrial-based option, space the only option right now, for communications platform resiliency. You can still go out in North Carolina and Western North Carolina, and you can't use a credit card in many places because they don't even have basic linkage for credit card processing. So how do we go back and say, go to the business community and say, what part of this would interest you? If you had, we're not going to write you a check and hope something good happens, but if we're able to match and do something different to encourage the private sector to come in and say, I can solve that problem for this price.
Right.
And we look at it and think of the government solution being a price this big, they'll do it for a price that big, and I don't care what kind of return they get as long as it's faster and lower cost than the government solution.
Right. One of the areas we've spoken with a lot of governors is part of this project and this kind of going to different places is the idea of innovation and how oftentimes private equity can help with that, the innovation economy. You have a tech sector. You mentioned biotech in North Carolina. What have you seen work when it comes to innovation in North Carolina in particular?
Well, to me, I'd like to see more innovation in government. That's the one thing that I'm looking at some folks that I worked with back when I was in the State House. I really wish that we could find ways to get the whole of government to be more efficient. I was a partner at PricewaterhouseCoopers, and when we were doing large projects back in the 90s, we just termed it as your mess for less. We would go into a business and say, here's your top line cost for IT. Here's your current service levels. We will do it for substantially less than that and maintain or improve service levels. Do you want to do a contract with us? Boy, I'd like to see that kind of focus on the whole of government to get it to be more innovative. I think for the most part, private sector is going to be as innovative as they need to be the winner. What we have to do is make sure that government's not standing in the way. And then I was telling, I have to tell you, I don't want to run out of time. Number one, I always dress casually, but today I want to let y'all know I brought my grandkids with me because I was at charter school this morning with my granddaughter having goodies with grands. But I think that we need to, with respect to innovation, it's like how do we just provide the minimum amount necessary and reduce the obstacles to innovating. The biggest problem we have now is no good deed goes unpunished. When somebody innovates, you want to regulate them. You saw that with AI. You know, you have this mentality. It was amazing. As somebody who spent my entire career in technology, how we had, when AI came on the scene, ChatGPT came out, greatest innovation, and large language models, not just ChatGPT, but the whole ecosystem that's come out of there. And now we have people say, well, we got to slow this down. And what was notable is some of the most vocal or the loudest voices in that argument were technology companies that needed to catch up. So I'm kind of wondering, we need to slow this down for about 6 months. I said, it sounds like you've got about a 6-month window before you've reached parity with ChatGPT. But that's just an example. I think government, instead of, what we need to do is not stifle innovation. Arguably, maybe we can stimulate it, but our biggest challenge is to prevent government from overreaching and stifling innovation, getting it out of the way. Holding you guys accountable, but not trying to think that the folks in Washington are really, technical computer scientists who kind of know how to kind of bend innovation to its liking.
One other issue that's come up is the idea of the education pipeline, making sure that there's a ready workforce as more investment comes into a state like North Carolina. Talk about what you've seen work here. Are there issues where you think that there could be more non-traditional education or other things that could help with just overall workforce?
Yeah, well, that's the granddaughter I went to school with this morning. She's my almost 7 years old in about a week. I asked her what she wanted to do when she grew up as we were riding into school. She said, I want to invent a time machine so I can travel back in time. And then when I said, why are you talking about that? She said, well, this is the quarter we're doing STEM work. So good news. I mean, we got science, technology, engineering, math. I got a 7-year-old or almost 7-year-old granddaughter that's thinking that way. The problem is, we have an over-optimistic view of how we solve the STEAM pipeline with our indigenous population. You don't get there by only, if we overachieve, in our wildest dreams, more STEM and STEAM kids coming out of public, private schools in the U.S., we're still going to be short. So we have to talk about how we're really plussing that up and holding school systems accountable for not graduating enough children, let alone in subject matters like STEAM that are very important to us. But we've also got to go out and recognize we've got to immigrate more people here legally to fill the gap. I mean, if we don't do that, we're going to repeat the same mistake that every other Western nation has made. I don't know why everybody doesn't understand that past is prologue. If you do exactly what China did, if you do exactly what Western Europe did, if you do exactly what Japan did, you're going to get exactly the same result. So why don't we do something different, plus up and get the education, our education, public, private, charter, geared towards really rewarding people that are pursuing these careers, but recognize there's still going to be a shortfall, and it can only be addressed through smart, merit-based immigration, legal immigration.
Let's shift the conversation to taxes. You had a big role in reforming the tax code in this state.
That was so much fun.
Walk us through what worked and maybe what are some lessons that could be learned at the federal level.
I am proud to say that even, we are now 13 or 12 years past the passage of a lot of our major tax reform. We didn't go back and change anything. We added to it. But we're the only state in this this century. It's a little cheap since we're only 24 years into it, but we're the only state in this millennium that has actually passed comprehensive tax reform and didn't have to go back and fix anything. All we did was then build on that success to have subsequent tax relief measures implemented by past legislatures. I think the federal government, the problem we have in our discussion, we're going to have the big tax package. You know, if Republicans sweep D.C., then we will use reconciliation to extend most of what was in the Jobs and Tax Cuts Act. We've got to figure out pay-fors and all that stuff. But in many respects, we're just trying to make the best of a bad situation. It would be great if we could do true, you know, big R tax reform that involved broadening the base, lowering the rate, getting rid of irrational exceptions and exemptions like we did in the state, and then have a triggering mechanism that's forward-looking. So what we did in North Carolina that was a bit different, and I had a lot of people looking at me like I had a horn growing out of my head when I first proposed it as speaker. They said, we don't know if we're going to get the revenue from this. I said, great. Then let's just create tranches where we have these tax cuts here, but prospective, we go ahead and implement the tax cuts if we hit certain audited revenues in the state general fund. And if we do, then those next tax cuts automatically kick in. Doesn't take another vote. It created that ratchet. It wouldn't go. It created a momentum that's really sustained itself to this day. Just about every session we're coming back trying to figure out how to tweak taxes. But we did broaden the base. We lowered the rate. I got a lot of friends mad at me for getting rid of, you know, putting a cap on the mortgage interest deduction. I'm married to a broker. I had all the realtors, you know, funding my opponent because they were mad at me for doing that. I don't care. I mean, if we're going to implement it, you got to take the political shots and come up with a rational, sustainable taxation system that's moderate. And I think North Carolina's done it about as well as any other state. And the proof's in the pudding. I mean, folks, if you were looking at North Carolina 10 years ago, you weren't seeing it in the top quartile for many business measures that I track. And now you see them consistently in the top quartile and the top decile almost consistently for the last 5 to 7 years. That's not an accident. That was a result of very good, sustained, focused work on the part of the past and current General Assembly. And the federal government can learn from that.
So we're almost out of time, but I want to get to two things, which is, one, reconciliation's a lot to bite off, even if you do have all three branches, to say the least. But it might be divided government. Talk about the one or two priorities for you that are must-dos in this tax package.
The tax package, I believe we should implement. We've got to do some work on GILTI tax. We could, you know, we're going to have a discussion about the corporate rate. I think that Harris is way off base. If you want to make us globally non-competitive, then implement Harris's 28% corporate tax rate. The money's just going to go where it flows to. And you know, I believe patriotism. I believe economic patriotism only counts when all other things are equal, right? When all other things are equal, then, you know, vote for your country team. But if we create an unlevel, or if we create an unworkable tax burden for corporations in the U.S., I would think less of them if they don't choose to go somewhere else. These are business people. They're not public servants. They have a fiduciary responsibility to return value to their investors. And we need to be careful to not increase tax burdens. We need to try and extend. I mean, it's going to be tough to pay for a lot of what we put in place in 2017. So we're going to have to make some tough choices. We see about a $300 or $400 billion nut on what we'd like to do for the GILTI tax correction. Is that right, Ryan? We've got a lot of headwinds there. So it's probably going to be something short of that. And are we going to be able to get support? If we're in divided government, it's going to take a 60-vote threshold.
Right.
I, for one, think that there are some tax provisions that we should go ahead and try to do. Let's say we run the table. I still think that we should try and build a case for some of the tax provisions to go to the 60-vote threshold. Why not? So that they could have some permanency and we can set them aside and then only use reconciliation for the things where we disagree. I think that you could, if we run the table, we can use the threat a reconciliation to say we can go here or we can go there. Do you want to come to the table and work with us? And we should be thinking that way so that we don't necessarily have to do everything with reconciliation. And when we do reconciliation, we've got to, as I said, we've got to find pay-fors. And undoubtedly, a lot of those pay-fors are going to come from repeal of various provisions in the American Rescue Plan and the Inflation Reduction Act. I mean, there's a lot of spending there that doesn't have a nexus with tax relief, and it sounds like those would be some of the buckets we have to go into. Now, having said that, it's not going to be just one of these really neat, you know, when the flight attendant says in the event of a crash, you know, do this. If we run the table and we're doing reconciliation, it's going to be a goat rodeo to get all Republicans on board with what will be razor-thin majorities. Right. And we saw that. We had the terrible twos back in 2017. Any two senators that wanted some new provision, we had to actually accommodate them because we needed their votes. We'll go through all that drama. But at the end of the day, I think if we run the table, we will succeed in getting a good portion of the most important parts of Jobs and Tax Cuts Act passed. And, you know, in full disclosure, I worked to defeat a bill that Wyden and Jason Smith, right, who's become a friend of mine, were working on. And a part of the reason why I opposed moving forward this year is I thought it was taking some negotiation leverage off the table.
This is the child tax credit package.
Yeah. A lot of CEOs called me up, Tom, we really hope you'll support that tax provision that I know you got to work on child tax credit, but we really want those tax provisions. I told them all the same thing. I said, you'd be guilty of malpractice if you didn't call and make this call, and I'd be guilty of malpractice if I actually passed the bill right now. Because it needs to be wrapped into the bigger tax package next year. We need to work on child tax credit. It's got to be one that makes sense. And next year, we should be able to go in and have some leverage to do that.
All right. Very interesting stuff. Senator, we're going to leave it there. Thank you so much this morning.
Thank you.
We appreciate it.
Yep. Take care.
All right. Take care. Thanks so much. All right. Now I'd like to welcome Drew Maloney, CEO of the American Investment Council, and Robert Mittl Jr., a neuroradiologist at Radiology Charlotte, to the stage for a fireside chat. All right, gentlemen, thank you so much. That's a tough act to follow, but we will do it.
Yes, absolutely.
All right. I want to kick off the conversation here with you, Dr. Mittl. Tell us a little bit about your story in healthcare and your firm, Charlotte Radiology.
Good. Well, I'm glad to be here. Thank you for having us. I'm a neuroradiologist. I work with Charlotte Radiology. First, I thought, just because a lot of people may not understand where radiology fits in healthcare delivery, talk a little bit about what we do and what services we provide. Yeah. The radiologist is sort of the ultimate consultant to other physicians. There are two types of radiologists. Most of us do imaging where we're reading x-rays or CAT scans or MRIs. And then there is a subset of radiologists who do procedures, sort of minimally invasive surgery almost, of trying to either diagnose or fix things deep inside the body using x-rays or ultrasound or something like that to guide what they're doing. When you've probably all had an x-ray or a CAT scan or an MRI, you are often meeting the highly skilled radiology technologist who is getting those images. What you may not be aware is after you leave, those images then are given to a radiologist who is a physician who is trained to interpret those images. And so that's what radiologists do. That's what I do most of every day. And so we're behind the scenes. We're not necessarily patient-facing, though there are some exceptions, which we'll go into in a little bit. But we are then consulting with the referring physician, with your primary care doctor or your surgeon, whoever who might have sent you for that imaging study, to help them understand. We are making the diagnoses in a lot of cases that go through the medical system every day. So that's what we do. I am been with Charlotte Radiology for 30 years. Joined back right when I came out of training. And like I said, I'm a neuroradiologist, which means I do mostly brain and spine imaging studies, doing that interpretation. We've been in Charlotte for over 55 years. Currently, we have 17 breast centers. We have a mobile mammography van, which you may have seen, big pink bus goes around and does screening mammograms for patients. And we also have a number of, I think the number's up to 7 imaging centers that we joint venture with our hospital partner, Atrium, here in the Charlotte area. We provide care to, we do over 1.5 million exams a year. That's a lot of studies. We employ over 100 physicians. We also have a number of advanced care practitioners, such as PAs and nurse practitioners, who help us with some of our procedures, and we employ 500 people here in Charlotte.
That is a big footprint and a lot of scans. U.S. Radiology is backed by private equity. Talk about what that has meant for patient care and also just your ability to expand. You've kind of been there for quite a while.
Yeah, so we, in 2018, we partnered with a private equity investment firm, Welsh Carson, and formed U.S. Radiology. And U.S. Radiology now has grown from just Charlotte Radiology to and our roughly, let's say, 30 imaging centers of different types that we have, to a national footprint. We're in 13 states. We have 175 imaging centers. We have 5,000 employees. We have over 350 physicians. So we've really sort of had a great growth curve. And again, most of our imaging centers are low-cost imaging centers, which provide access to patients at a low price point, easy to get to, freestanding, not going into a hospital trying to navigate and that sort of thing. Our partnership with private equity has allowed us to gain capital and expertise to grow and continue to expand that access, that low-cost option for patients. And so Charlotte is one of the fastest growing metropolitan areas in the country. And so since we've formed U.S. Radiology and had our investment partner join us, we've opened 3 new mammography centers and 2 new of these joint venture centers to keep up with the growth, to continue to provide the access to patients that we need to do. We have also, what a private equity partner brings to a physician group is capital and expertise. And so the capital I've talked about to help us continue to grow this very capital intensive imaging center, mammography center sort of business. But also the expertise is an increasingly important thing that is needed to help physicians navigate the world. Back when Charlotte Radiology was performed, you had a very small back office. There weren't a lot of rules and regulations that you had to deal with. Now you've got compliance and credentialing and billing and collections and IT sophistication and cybersecurity concerns, and the list just keeps going on and on. And there's also a trend for those coming out of training, physicians coming out of training. Doctors just want to be doctors. It's not like the last generation or two where you took care of patients all day and then you managed your practice in your free time. There's more of a healthy emphasis on work-life balance. And so physicians coming out of training especially are looking to just practice medicine, not have to worry about the management. So the expertise brought to bear in managing and running a practice allows us to recruit and retain radiologists who are attracted by the opportunity to focus on clinical care. And so that has helped us navigate a physician shortage. Every specialty you've probably read about, there's a shortage of physicians. It's especially acute in radiology because the number of scans being done is growing much faster than the number of people who are being trained in radiology. So it's key for us to be able to recruit and retain. Now, when I talked about how you go through getting your scan, you also meet the radiology technologist, a highly skilled non-physician staff member who has been trained to perform that exam. There's also a shortage of radiology technologists. And so what U.S. Radiology and the management expertise they brought to bear and the experience has allowed us to establish is a Technologist Advancement Academy. And we offer this free to our existing hired staff if they want to go beyond their current level of training. A lot of people start out by being trained in basic X-ray. Well, now we offer career advancement free within our organization to these technologists to get certification for more advanced examinations like CT and MR. And that allows us to deal with a severe shortage of advanced technologists as well. So our partnership with private equity has given us the capital to expand, give us the expertise to manage our practices, navigate the shortage of physicians, and navigate the shortage of technologists.
Great. Drew, I want to bring you into the conversation. We are in Charlotte, North Carolina. Can you talk about private equity investment in the state, particularly as results with small businesses?
Yeah. Well, Anna, it's great to be back in North Carolina, and I think as Senator Tillis just said, this is a great place to invest. North Carolina is now the 9th largest recipient of private equity dollars in the country. There are 600 businesses backed by private equity in the state. About 85% of those businesses are small. 375,000 employees that are backed by private equity businesses. And as the senator said, there are great pockets of investment around the state. And whether it's biomedical research and Research Triangle, it's the financial services sector, it's the energy sector, it's small businesses and services companies. They're all in need of capital, and that's what private equity does. And I think what's really been important, and as we talked to Dr. Mittl about Charlotte Radiology, is private equity is really a partnership with these businesses. We help provide the capital, and as Dr. Mittl said, this is a hugely capitally intensive business that needs to keep up with technology, that, and I'm sure you'll talk about this, that needs to work with AI to keep up with whatever the demands of the new world are. And that capital was provided by us. And we work side by side with people like Dr. Mittl who have this idea and say, I have an idea to make U.S. radiology and create this business that can reach more people, do more mammography screenings, have mobile units, really be patient-facing, and just partner and get the capital that they need from the private equity firms.
Dr. Mittl, private equity in healthcare has been in the news a lot lately. What's your perspective on the investment in this sector and, and some of the coverage?
Yeah, no, there's an unfortunate narrative, which is unfair and inaccurate, about the effects of private equity investment in healthcare. It's presumed, without looking at the data, that it's bad for patients, has negative impact on physicians, it hurts quality, it prevents community or drives down community engagement. So in our own world, let's look at the actual data. Patient satisfaction ratings across U.S. radiology are 97%. In Charlotte Radiology in particular, 98% satisfied. That is the envy of any healthcare entity. You just don't see that. Physicians, I talked about the physician shortage. The American College of Radiology has looked at the rate of turnover in practices of all types across the country, academic, hospital-based, private practice, et cetera. Our turnover rate is half of the average across the country because we provide a culture, competitive compensation, a technology-driven environment that you want to work in. So we are able to not only attract new hires, but retain them. Quality. That is usually the thing that is held against private equity in medicine. Well, let's look at the data. Screening mammography. Women should come after a certain age every year for a screening mammogram to look for early breast cancer. You get 2 views of each breast, go home a couple days later. Most people get a letter saying you're fine. But sometimes we see something we're not sure, we need you to come back and do a little more evaluation. And the end result is, how many cancers do you find per 1,000 patients? And how many do you have to call back and evaluate to get that number of cancers? There are benchmarks out there. There are widely accepted performance goals or targets or benchmarks that you should be able to achieve. In U.S. radiology, we do 500,000 screening mammograms a year. And compared to benchmark, we perform better in the number of cancers we find per 1,000 than the average practice. And we perform better in having fewer false positive callbacks, calling back people and putting them through the cost and the anxiety and maybe the discomfort of procedures and evaluation. So the data shows that we are superior performers in detecting cancers. The vast majority are early small ones, which are lower cost to treat, better outcomes. without calling back an excessive number of patients to find that high number of cancers. And then community engagement. There's this narrative that that's not the interest in private equity. Charlotte Radiology, for a number of years, has partnered with Levine Cancer Institute and provided free screening mammograms to uninsured or underinsured patients in the Charlotte community. These are often patients who've never had a screening mammogram, or they haven't had one for years. We find a number of cancers, a higher rate of cancers in this underserved population. This is done free of charge. You may have seen our big pink bus. We bring it around to areas of community so it's easy for people to come in and get these things done. This has been supported and grown with our private equity partner. It is part of our mission, which they embrace. And so, again, looking back at the narrative, private equity is bad for patients, doctors, quality, engagement. The reality is the opposite.
Drew, I want to shift gears a little bit. We spoke with Senator Tillis about the big agenda item for next year, right? No matter who wins in a few weeks is going to be tax reform. We heard about his ideas, kind of what he learned from his kind of time at the North Carolina state level. What are your thoughts when it comes to the upcoming tax debate?
Look, I think the points he raised were accurate. Lawmakers have to consider policies that encourage investment, innovation, and economic growth. And what we have to steer away from is any sort of punitive tax policies that discourage people like Dr. Mittl or small businesses throughout the country from investing dollars and being able to grow those businesses, because these punitive policies and just picking winners and losers out there will, at the end of the day, only hurt economic growth, only hurt small businesses, and obviously hurt the employees that work there. And I think that's what they need to focus on as they go into tax policy. Companies need certainty to plan, and I think the next year to 2 years, we'll see how that certainty shakes out.
It's going to be a very interesting time in Washington, that's for sure. Gentlemen, we are almost out of time, but before I let you go, I want to do a quick fire. We have a lot of folks here from North Carolina, as well as those on the live stream in Washington. What's the one takeaway you hope they have from our conversation today? I'll start with you, and Drew, you can have the last word.
Private equity investment in healthcare has many positives. I'm going to digress on one side. Everyone wants to know about artificial intelligence in radiology. 10 years ago, they said physicians were going to be replaced by, radiologists were going to be replaced by artificial intelligence. Well, it turns out that was hype, that was overblown. But what is the reality now is that radiologists who use AI will replace radiologists who do not use AI. Our equity partner has allowed us to implement artificial intelligence across our footprint, which will drive better patient outcomes. The reality is private equity investment in healthcare is better for patients, it's good for doctors, it's better for quality, and maintains community engagement.
All right, Drew.
Anna, I think Dr. Mittl's message is right on. Private equity partners with businesses like Charlotte Radiology to improve lives and improve the community they work in. And that's as simple as it is.
All right, gentlemen, we're going to leave it there. Thank you all so much for joining us this morning. A big thank you to Senator Thom Tillis and his team for making it possible in such a busy time in the state. And a big thank you to the American Investment Council for making conversations like this possible. Have a great day and stay safe, everybody.
Okay, thank you.